All right, welcome. Today we are diving into a real medical detective story. It's about a condition that can pop up out of nowhere with a list of culprits that will honestly surprise you. We're talking about foot drop. I want you to just picture this for a second. You're just walking, minding your own business, and suddenly the front of your foot just won't lift. You start catching your toe on the carpet, tripping over absolutely nothing. It's a bizarre and frankly scary feeling. What in the world is going on inside your body to make that happen? Well, that brings us right to the first part of our investigation. We need to get the lay of the land. So let's open the case file. What is foot drop really? So here's the key thing to understand. Foot drop isn't actually a disease in itself. It's a symptom. It's the simple but profound inability to lift the front part of your foot. And because of that, your body has to compensate, creating this thing called a steppage gait, where you lift your knee way up high, kind of like you're always climbing stairs, just to stop your toes from dragging. And this is not just some small inconvenience. The impact on a person's life can be huge. Get this, some studies show that up to 69% of patients with foot drop end up needing some kind of long-term mobility aid just to walk around safely. Yeah, that statistic really brings it home, doesn't it? So, to solve the mystery of what's causing this, every good detective needs a map. And in this case, our map is the anatomy, the actual nerve pathway that's supposed to be lifting your foot. Understanding its journey is going to be key to finding the clues. Okay, so let's trace the route of our main person of interest here, the common peroneal nerve. It all starts way up in the lower back, where it branches off the giant sciatic nerve. From there, it travels all the way down the back of your leg until it gets to your knee. And this is where it hits a really critical point in its journey, because it takes this sharp turn, wrapping right around the top of the fibula bone, which is that bone on the outside of your knee. And right here, this is the hot spot. This is the scene of the crime. The nerve is incredibly exposed. It's super close to the skin with almost no muscle or fat protecting it. That makes it extremely vulnerable to getting squished or injured. All right, so now that we know where the crime is most likely to happen, it's time to round up the suspects. And let me tell you, the list of potential causes for foot drop is surprisingly long and, well, pretty interesting. A quick look at the evidence here tells a pretty clear story. See that biggest slice of the pie? Most of the time, the problem is directly related to that peroneal nerve we were just talking about. But look at that other big chunk. Problems starting way up in the lower back are a major factor too, plus a few other culprits we need to look into. Let's start with our prime suspect, which a lot of the time is just simple external pressure. This is where that vulnerable spot right by the knee becomes so important. And you're not going to believe some of these. We're talking about things you might do every single day. Just habitually crossing your legs can be enough to compress that nerve. Squatting for a long time even has its own name, strawberry picker's palsy. And get this, losing a lot of weight really fast can cause it too. They call it slimmer's palsy because you lose the natural fatty padding that was protecting the nerve. Okay, but the problem isn't always right there at the knee. For our next suspect, we have to look upstream, all the way back to where the nerve starts, in your lumbar spine. Right, so a herniated disc or a narrowing of the spinal canal can literally pinch the very nerve roots that eventually become the peroneal nerve. And as you can see from the data, compression way up at the L5 and S1 levels of the spine is a really common cause. It's a huge clue that the problem can be happening far away from where you actually feel the symptom. So our third major suspect involves more direct damage. We're talking about trauma from an accident or, pretty surprisingly, as a complication from a medical procedure. A direct hit to the knee, a fracture, a dislocation, those can all easily damage the nerve. But what's also really significant is what we call iatrogenic injury, which is just a fancy way of saying harm caused by medical treatment. In fact, one study looking at foot drop after trauma surgery found that a staggering 17.4% of the cases were caused by the surgery itself. So with all these potential suspects running around, lifestyle habits, spinal issues, accidents, how on earth do doctors figure out which one is the real culprit? Well, they use a really systematic investigation process, and it starts with some hands-on detective work. First up is the physical exam. The doctor is looking for key clues. They'll test the specific muscles that lift the foot up, that's dorsiflexion, and turn it outwards. They'll check your reflexes, which can help them figure out if the problem's in your back or further down your leg. They might even gently tap right over the nerve at your knee. If you get a zinging or tingling feeling, that's a positive Tinel's sign, and it's a huge clue the problem is right there. Okay, next, they bring in the high-tech gadgets. Here's the best way to think about it. Your nerve is like an electrical wire. So they'll do tests like an EMG, which basically answer the question, how well is this wire working? Is the signal getting through? Then they'll use imaging like an MRI to answer a totally different question. Is something physical, like a bulging disc, actually pressing on the wire? You really need both to solve the puzzle. So once the culprit has been identified, the case isn't closed. The final chapter is all about the path to recovery, and the treatment plan has to be tailored specifically to whatever caused the problem in the first place. Broadly speaking, treatments fall into two camps. You've got your non-surgical options, which are the first line of defense. They focus on support and letting the body heal. But for more stubborn or structural problems, you might need surgical interventions to go in and physically fix the issue. On the non-surgical side of things, physical therapy is absolutely crucial to keep the muscle strong. Special braces, called AFROs, can physically hold the foot in the right position so you can walk more safely. And sometimes, if the cause was just pressure, the cure is as simple as activity modification. Like, just stop crossing your legs. Now, if surgery is what's needed, the options are very targeted. If the nerve is just being squished, a surgeon can go in and decompress it, basically giving it more room. In cases that have been around for a while, they can even do something amazing called a tendon transfer, where they reroute a healthy tendon to do the job of the muscles that aren't working. And of course, if the problem is a disc in your back, spinal surgery can fix it right at the source. And all of this brings us back to the single most important takeaway from this whole investigation. You have to remember, foot drop itself is just the alarm bell ringing. The real detective work, the thing that matters most, is figuring out exactly what is pulling that alarm. Finding the root cause, that is everything. You know, this whole case kind of leaves you with a bigger question. If one single, tiny nerve can be knocked out by something as simple as how you sit, what does that say about the rest of our body's incredibly intricate and delicate wiring? And what does it really take to protect that entire vital system? Makes you think, doesn't it?